Hi again, this is Gina, vlog number 2. I went to my oral surgeon appointment this afternoon. Got some good news and some bad news, I guess. Bad news isn't that bad though. There's 2 teeth in particular that may cause an issue because they are, the roots are up into the sinus cavity. And so the oral surgeon said that once he pulls those teeth, there will be a hole in my sinus cavity. He will close it up. He'll suture it up. But he said that probably like 99% chance that I will get a really bad sinus infection immediately following him pulling the teeth. He said that he can prescribe some antibiotics for that right away, so I can start taking that either prior or right after I have the oral surgery. He feels that he can take all my teeth in his office, but he needs to have it verified through my primary doctor, which my primary doctor says it's up to the oral surgeon. So we'll see how that goes. I'll have to contact her tomorrow and probably set up an appointment soon so we can get this taken care of. I was also told I'm declared disabled because of my chronic autoimmune conditions that I have, which are I have diabetes, I have neuropathy of my feet and my legs up to my knees and in my hands. I have psoriatic arthritis. I have psoriasis. There's a whole bunch of different things. Autoimmune, once you have one on an autoimmune condition, you have a ton more. I have fibromyalgia. One doctor said I had Sjogren's. Another doctor said I did not have that. One doctor has said I've had lupus, or I have lupus. Another doctor said, no, I do not have that. I've seen a slew of doctors and specialists. I had a primary doctor quit me because I was diagnosed by another doctor, and she did not like that too well, and she screamed and yelled at me and then refused to see me again. That was the same doctor that prescribed the gabapentin that made my teeth do this. They're broken off to the gum. They're broken off here. The enamel has come off. And on the upper also, which this causes a lot of abscesses. I've had cellulitis of the face. Been in the ER, I don't know how many times. I can't even count. Numerous times. Antibiotics, certain antibiotics stopped working for me. So they had to do other antibiotics. They had to give me shots. They had to give me, since I take tramadol and I take a Percocet every day for the pain for my chronic conditions. So when I do have abscesses and cellulitis of the face, I'm unrecognizable. I look like Lisa Simpson. I have like a duck face. This last one, I had 2 abscesses in my sinus cavity and here, and made my nose swell, my eyes swell, and then it got black and blue, and my lips were out to here. I went to the ER here in my town, and they did nothing for me. They didn't even, well, they did give me clindamycin, but they came in, looked at my face, just looked at it. They didn't look at my teeth. Nothing. They didn't ask me about conditions, nothing. They didn't ask me if I was in pain. They didn't offer me any pain medication. They just gave me clindamycin and sent me on my way. Clindamycin did not work. I ended up, my daughter-in-law is a nurse, and she took me to her hospital. Well, it's affiliate of her hospital, and they did everything. They were awesome. They took tests. They did an MRI and found the abscesses and where they were, and in my sinuses, and to see how bad it was. Sepsis. I mean, just they took care of me. They gave me a shot of an antibiotic. They sent me home with a different prescription of antibiotic. They gave me pain meds. So it, all these different doctors and dentists and stuff like that, you have to find the right one that works with you and for you, and it's a great advocate for you and your conditions. Anyway, back to the back to the oral surgeon today. Since I am disabled, I'm on Medicare A and B, and I also have Denti-Cal. I live in the state of California. I also have partnership. Whatever Medicare does not cover, partnership is supposed to cover. I do my research very well. I contacted each one of those and found out what it would cover and what it would not. Even if I had to have this oral surgery done in a hospital setting, all of these insurances together were supposed to cover everything. I was not supposed to pay out of pocket for anything. Today I was told differently by the office secretary. I was told that I would have to pay $200, which is supposedly really cheap. My insurances do cover most everything, but they do not cover after he removes my teeth for him to shave the bone down for the dentures. He likes to do that right after he performs the surgery. Therefore, he doesn't have to come back and do it at a later date. And if that has to happen, then it goes into thousands of dollars, because then he has to reopen everything and then shave the bone. So I will have to save up $200. I'm on a fixed income because, like I said, I'm disabled. And I get disability and SSI. So anyhow, they're contacting my doctor and to get a clean bill of health so I can go through with this and find out whether or not she wants me to have it done in a hospital setting or in the oral surgeon's office. He says that it would take several weeks for me to heal, because with my conditions it's even going to take a little bit longer. The office secretary said that if it can be done in his office, we can have it done next month, which is December. If we have to wait for a hospital setting, it won't be until next year, early sometime. So that's where we are with that. So hopefully I'll know something by next week by talking with my primary doctor, and then the oral surgeon office staff will call me back and set up an appointment either way, with either a hospital setting environment, which would have to be done by a different oral surgeon, or with this oral surgeon at his office. All right. I'm really tired. It's been a long day. I'm going to go to bed, and hopefully I will be talking to you again in the next couple days. Have a great night.